On the occasion of International Women's Day, we at the World Stroke Academy want to celebrate the achievements and careers of women in stroke, and we would like to recognize their contributions, their research, and their mentoring. We interviewed outstanding women who are nominated by WSO Board members for their important work in the field of stroke. This is the first episode of the Women in Stroke initiative. I am Laura Ceci-Galanos, the Executive Manager of the World Stroke Academy, and I'm here today with Haruko Yamamoto. As a physician, a researcher, a regulator, and a family of stroke survivors, Haruko started her career as a stroke physician at National Cerebral and Cardiovascular Center. After 5 years resident life, she studied in Lausanne University Hospital and Osaka University Hospital, where she received her doctoral degree. She started a new career as a new drug reviewer in the millennium year. She reviewed low-dose aspirin and cilostazol as a drugs for second prevention of stroke and made a great contribution to let's start a domestic clinical trial of alteplase. After returning to NCVC, has begun another career, a clinical trial professional, designing and producing clinical trials for development of new drugs and medical devices to make stroke treatment better. She was also a family of stroke survivors. Her grandmother, grandfather, and father suffered stroke. Her grandfather, who taught mathematics in a junior high school, got acalculia. Her talkative father got aphasia. She is a person who knows the stroke survivor's pain of sudden loss of their faculties. Haruko, first of all, congratulations on the nomination from the WSO board members. It is wonderful to have you with us today.
Thank you very much. It's my honor to be here.
Thank you. So we will start with a couple of questions that we're interested in hearing your thoughts on. I would firstly like to ask you, what does being outstanding in your field of work mean to you? So how do you usually measure success?
I was a little bit confused with this question because it's very interesting, but I never thought that such outstanding or something, because I always followed my interest.
Mm-hmm.
So I started my career in fact, I started my career, professional career as a psychiatrist. And I was interested in higher brain dysfunction, and also it led me to stroke world.
Mm-hmm.
And I think others thought I changed my career, but for me it's the same thing. So higher brain dysfunction. So the stroke people have higher brain dysfunction. So it's in my heart, it's how can I say, on the main the same route. Mm-hmm. But after I changed a little bit my career, because I went to I got, it's just coincidence, but and I got a post in regulatory agency where they review the new drugs and new medical devices. But at that time, it's really just coincidence. But they were reviewing aspirin, low-dose aspirin for secondary prevention of stroke. So I could take part in the review, and so it was my honor to contribute something for a better treatment of stroke.
Mm-hmm.
And after I very interested in clinical trials, but in the regulatory agency we just review. We don't create trials for patients and for better treatment. So when I returned to the National Cerebral and Cardiovascular Center, I got a position of clinical trial management office, and I got a director and I supported the researchers, and I support to create and prepare and do the clinical trials efficiently and successfully.
So it's really following your interests that
Yeah,
brought you
always.
success.
Yeah.
Instead following the flow of the river.
Yeah, yeah. My career has been like a river rafting.
Perfect. That's very nice. And besides the topics that you mentioned now, like clinical trials, is there any other area that you would have liked, or maybe that you would still like to stand out?
Yeah, I don't know. I like to stand out, but I'm interested in communication with the patients. So many stroke survivors and stroke survivors' families, they need really help and consultation and the good advices. And so I myself think the such a needs not be fully satisfied in my country. So it's now getting better and better. But because I have seen many stroke patients as a clinician, and also I'm a family member of stroke survivors. So I think I will be contribute to such a patient support also.
Wonderful, absolutely. We are in the topic of women in stroke, and this is a question that we also asked last year in this initiative. In your opinion, what are the reasons for women's lack of advancement into leadership positions, despite there not being any visible barriers? What is your opinion on that?
I think there are some visible barriers in Japan and also invisible one too. Some visible ones are especially in medical settings. We don't we always feel shortage of human resources in medical settings. So we need more people in hospitals and also in some nursing homes or and so on. And so because of the shortage of the chronic shortage of human resources, so especially female doctors and female health professionals are very suffer from taking maternal leaves or other how can I say time for so suffers from getting time for caring their children, their families. So it's now in Japan, this issue has began to discuss in the government. But I think the solution will come a few years later.
Yeah.
So I think so now young colleagues, young female doctor colleagues are very suffering from that.
And as a well, as a woman yourself, would you have any advice to maybe younger female colleagues who feel that they are not taken as seriously by patients or even colleagues at work?
Yeah, I think most female doctors, young colleagues, are very smart, very. I think they're. They're very good doctors, but sometimes they feel not. How can I say? They feel not satisfied. How can I say? Oh, sorry. they're not confident in their ability. And so my advice is believe yourself. Believe believe your ability. And so female doctors tend to take more maternal leaves or some other leaves. So they make some, how can I say, sometimes they stop their career. But I think everything make our professional life richer. Every experiment, every experience make your professional life richer. So if you have an experience of grow up the children, so your view may become broader than someone without such an experience. So I think we should treat every aspect I think every aspect of life is very precious for our professional life.
Perfect. That's very good.
So I think at that time, at every moment, if you do your best in every moment, so you can get something. So you can success.
You can success and benefit from it. Yeah, so follow your interests and do the best at all times. That's great advice. There is another question that I wanted to make sure to ask you because of your background, because of your experience as a relative of stroke survivors, and thank you for sharing that with us. What would you say is the most important aspect of post-stroke care in your opinion?
I think now in Japan we have now a new act for stroke patients. The name of the law is let me see. Now we have the Cerebrovascular and Cardiovascular Disease Control Act. So it was enforced in 2018. So the law, this act will make stroke survivors' care better. And now the system has been started. But I think so now we have more better access to rehabilitation or helper or some nurse visits or some and so on. But I think the special care for higher brain dysfunction is lacking, not very good, because higher brain dysfunction is very various. So, for example, if you have aphasia, but each aphasic patients have different difficulties. So the care for a higher brain dysfunction should be more personalized. And it's not so it's not like places. So it's not it's not the matter of physical rehabilitation trainings or something. So it's not a matter of drugs or medical devices. So I think they need special personalized care.
Absolutely. I want to thank you for your time. There are a lot of more questions that we would like to ask you, and maybe in the future we can do a part 2 of this interview. But for now, once again, I thank you for your time. Thank you for coming to answer these questions that we have prepared for you. And hopefully we will see you again soon for another conversation like this one.
Okay, thank you very much.
And congratulations on your work.
Thank you very much.
Thank you.
Thank you for listening to this podcast. You can find additional stroke education material and resources in our World Stroke Academy website and social media channels.